So all that I will present is my ideas of my future work. The topic is improving health for mobile health and geographic information system in Mozambique. The mobile health field is recently new, and it seeks to identify appropriate mobile-based applications and implementation strategies to address public health challenges. While GIS, it's a relatively old field, and it's mainly a tool that allows for storage, management, manipulation, and visualization of spatial data. So we have the mobile phones coming from the mobile health field, plus GIS. What I believe is that we will have a combination of maps plus non-spatial data. And the non-spatial data, it's part of the data that can be collected using mobile phones. So far, my literature review results shows that mobile health in developing countries can be used in 6 areas. Education and awareness, where the mobile phones can be used to make the health practitioners and the health and also patients understand their problems, and also can be used for remote data collection. Currently, the main issue in the health sector is with availability of data, especially at the data collection point. The data is collected, but it's not delivered on time. So this is a very important issue. And also, it has been used for remote monitoring, communication and training for health workers, disease and epidemic outbreak tracking, and the diagnostic and treatment support. Diagnostic and treatment support is another very important issue here. Like the presentation from Christine, I would say that if we can bring the mobiles in that, and she also explained that it's possible to use the mobile phones to display the system and use it for both sides, the health practitioner and the health, the people that benefit from that. So it's possible, for instance, if we talk about the HIV, it's possible to use this to get information from the hospital. For instance, there's a study currently being done in Mozambique where the mobile phones are used. There's a system which sends message to HIV patients, reminding them to take medicines or to go to the hospital for appointments. GIS, I've also identified this during my literature review. I've identified at least 10, but I've selected the ones that I'm interested in including in my study. The first one is finding out geographic distribution and variation of diseases. We have 4 important disease problems in Mozambique, which include HIV, cholera, TB, and malaria. So it's important to know where the incidence of these diseases happen countrywide. And also, GIS can be used for disease surveillance, make population at risk, and certify risk factors. For instance, if it's possible, for instance, to know where people are suffering for a disease like cholera after floods, for instance, you can use it for that, the GIS, and map the population that's surrounding in that region, and possibly take decisions on whether what kind of need these people should get from the Ministry of Health. It's also possible to use GIS to monitor diseases and then prevention over time, manage patient care environment, material and human resources, provide public health information using maps on the internet. And I'm very interested in building a system which is a web-based system to help monitor disease outbreak. So I have 2 questions for this research. What are the potential of mobile phone and GIS to improve health in Mozambique? And what are challenges and strategies associated with using mobile phone and GIS for surveillance, epidemic, outbreak tracking? So, in order to tackle the research questions, I've decided that I will have 4 objectives. The first one is to investigate current trends of mobile health and GIS use in targeting important health in Mozambique, the 4 important health problems, the ones that I mentioned before. And identify the development and potential of mobile phones and GIS and the health planning phase. Define the role of mobile phones and GIS in monitoring common health burdens and assess potentials and challenge and device strategies associated with using mobile phones. These objectives, I'm planning to meet them by carrying out 4 studies. The first one, it's about a literature review of how mobile phones and GIS have been used in the health sector. The second one is about building a system or a model that can help detect disease outbreaks. I have selected so far 6 health facilities where I'm planning to implement this web-based application. And the third one is it's a study about what challenges and opportunities are in place in order to use the system that I'm planning to build in this second study. And the last one is about what policies need to be encountered or analyzed in order to see, to understand the feasibility and how we can implement the system in Mozambique. Conclusions. So far, what I understand is that GIS, it has its potentiality in the health sector and also mobile health. And the marriage between the mobile health and GIS can provide an integrated approach to disease control and surveillance at the national, local, and province levels. Thank you very much.
Thank you for your presentation.
Joseph. No, you be closer to that.
Questions, please.
Thank you for your presentation. I was wondering, talking about a web-based application for data collection and analysis, I guess, also related to geographical information. I would recommend you to contact, I don't know if you know them, but the Health Information Systems Program at the University of Oslo. They have been, like, the last 15 years working
The
on
GIS system.
yeah, the GIS. It is open source, and they have now a big project called Mobile Health. So they are also moving it to mobile devices. So I don't know if the effort of design and implement a new application does really work for you, or maybe you can adapt or collaborate in the existing implementation of open source and complete your study with this kind of solution.
Thank you very much for reminding me about this. Because I know that this mobile health project running at the University of Oslo, and they have also developed a system which is called DHIS, and it's also running in some in some countries like Vietnam. They've tried in Mozambique; it didn't work quite well, but I guess I can also use some of this.
Yeah, but I think it is also an interesting point now in Mozambique, because the Minister of Health actually made a call before summer for this kind of applications. So I think it would be interesting to contact them. Also, Professor Nhavoto and Universidad de Fernando Mondlane is also like that, and some other PhD students, Mozambican students. So, and just a comment. I'm always a little bit skeptical on talking about a certain solution, a device-based solution, rather than talking more broadly about e-health and then say, okay, in which situation a device is, which device is the optimal in each setting. And then sometimes it can be wide, sometimes it can be PC, it can be something else. I don't know.
Yeah, I see your point. I had a discussion with my supervisor about this, and then I decided instead of, because what I've seen in Africa is that there's very good projects, but they fail in one thing. That is my point of view. Instead of, for instance, when we talk about the use of mobile phones for data collection, instead of using, for instance, PID, this PID technology, or even these mobile phones that have, for instance, Java integrated features, instead of using all these things, because at the ground level where the health workers play a role, there's these people, they have problems with the use of technology. So instead of going that way, I would suggest that the data collection should be used in a very simple way. For instance, texting, using text message to say, okay, today we have 10 malaria cases, and send this data, instead of filling in a form in a cell phone and send it. So the point, for me, it's not about technology itself. It's about the use of the basic features of a mobile phone for data collection, information delivery, and so on. That's my point of view.
I'm touched by your topic and by her topic. It is in health and it's in Africa. One thing you should bear in mind is the impact of these technologies and those who are using them. You mentioned something nice to do with the importance of the mobile phone. That is, it can be used to remind patients to come to hospitals for treatment or take their drugs and so forth. But I would like you to also earmark the ethical issues which go with the use of mobile phones. Experience is showing that health workers who are not well remunerated abuse these things. And I always tell in conferences that I fell a victim, and I don't want many Africans to go to fall victim again. This is using the mobile phone to call a patient for a surgical operation. You accept the patient, and the person comes thinking that you're going to heal her, but in 20 minutes you crash her dead. Now this is the abuse of that mobile phone we're talking about for communicating to patients. So I would like you to, if possible, to bring it out so that whoever reads your research should see the advantages of these mobile phones to improving health sector, but again, that abuse should be reduced.
The ethical issue.
Yeah, very true. I've dragged the hospital to court. It's a huge issue now.
Yes, we get another question.
Well, it's a very interesting piece today. Since you said it's a part of your PhD program, so I want to ask a very annoying question. The question is, so what? What's your theoretical contribution to the ICT4D?
And thank you very much for the question. So far, what I was thinking is, at the methodological side, I was thinking of using action research. And it's not, I mean, I know that action research is, you can use it, for instance, to develop a theory. But I was thinking of something like theory testing. Choose a theory that I can test the theory by doing my work. So the theoretical contribution essentially would be a test of this theory. I haven't selected any of this bunch of theories, but I was thinking of taking one and, for instance, user acceptance would be one to be tested. One that probably embed the social and technical relationship of this, and also the ethical issues surrounding this study.
Okay.
So I haven't decided exactly which theory I'm going to use, but I'm thinking of testing theory.
That's your country. Yes.
What I understand about research in PhD, you must have a novel idea. According to you, what is your, can I say your novel idea for this research?
Okay. Well, I don't really see it as a novel idea, but probably it is. And from what I've read about the use of mobile phones and the geographic information system, the health sector, is that we fail in first, especially in Africa, understanding what are the human resources that we have in Africa. And the other issue is regarding the financial side of it. So what I'm thinking is, instead of concentrating more on the technical, on the IT artifact side, I'm thinking of taking the basic of the mobile phones and use it in the health sector, even at the geographic information system side. When I did my master, I proposed a system where I have a GIS to map malaria, and I've chosen some provinces to do that. I did that, but I tried, and I also tried to take this solution to the Minister of Health. But I faced some resistance first, because they know, and I know, that we don't have human resource to work with this system. So my idea now is, okay, instead of developing a system with a lot of technical things, let's try to make something very simple. Very, very simple. What I'm trying to say is, for instance, I'm not using the way around where you put a map in a mobile phone, but probably we can put at the national level a computer which collects information, non-spatial information, using mobile phones, plus the maps that we already have, and display what is happening in the entire country or in some places.
I have a suggestion. I know that this crowdsourcing was mainly used, and that's having a computer. I think it's I don't know if you have heard about the Ushahidi platform.
Yeah. But it
That's
has been closed down, right?
Developed in Kenya, I think.
Has it been closed down?
Yeah,
This
and it's crowdsourcing, and what it does, I think, it has a computer centrally somewhere, and then people report abuse of human rights or that kind of stuff. So my idea is, cannot it, by mobile phone, by text messaging, because then it is, of course, there is a lot of human effort to filter this, because if you receive a lot of messages, sometimes they are fake, sometimes, so the main problem is to actually filter which one are the ones that are really reporting something and which are not. And I thought that maybe this can be used for health, as you said, to report cases of malaria or cholera or whatever disease it is. So if the Ministry of Health wants to know, and if, well, here the problem would be to make people really interested to report that, since if I'm sick, I don't know whether I would like, maybe my neighbor would report it, but if I'm feeling sick, I wouldn't maybe report it even if I have the facilities and everything. So this, how do you think of this kind of issues, more human, because you will find technology. I don't think the technology is the problem. Mostly these human factors, the ethical issues that she said, and all this kind of thing are really to be explored in order to implement something that will be accepted. Otherwise,
I don't know if I understand, it's a question or a comment.
it's kind of a comment, and how you would approach the human issues, maybe this would be the question.
Well, I'll take an example of a system, as I mentioned in my presentation, or in this discussion. that what they decided to do, for instance, to tackle the ethical issue, they've decided to choose randomly people with HIV. And they say a mother with HIV or the kid with HIV, is born with HIV. So they've decided to go through a list of questions, invite this person and ask these questions and say, okay, you can be part of the study. This is to tackle the ethical issue. I mean, there's a paper which says, okay, I accept that I can receive SMS, I can text you as a feedback of the message that you sent to me. But then, the way I see so far is that they have a problem with how they process all this information. And there's also something missing, the feedback from the patient, and how they can handle this feedback. What they are interested now is, instead of only sending message to the patient and reminding, for instance, to take medicines or to go to the health center again, if it's a mother, for instance, or if it's a woman and she's pregnant and she's supposed to deliver it within a month or something like that, then she can receive a message and then she can text back and say, okay, I delivered the baby. But then the problem is, how do you understand, because people write in very different ways, how do you understand that these messages really means that she's delivered the baby? And then the idea is to say, okay, congratulations for your baby and so on. And the other thing is that the way they have implemented this system, they have, I call it offline system. And then how do you, in 10 provinces or in 10 districts, how do you manage all this information? So this is why you bring this cloud solution, where you have only a central computer which collects everything, and you have some people which are expert, or they only do a job of analyzing the message or the information that is stored in the computer and then send it as feedback. And the most important of these things is decision-making side. If we know that, for instance, if it's a malaria, we know that we have a lot of cases, and we reach a limit whereby you say, okay, this number of cases is fine, it's green, and this is yellow, and this is red, then we have to do something if it's red, or even if it's yellow. Yeah, that's what
I have is all these things that you're describing existing now? Yellow, red, and...
well, this is my idea.
Okay,
This
if that
my
is your
idea.
idea, if that
Yeah,
is your
it's my
idea,
idea.
if that is your idea, why don't you build this?
So what I'm doing now, I'm doing a data collection. I'm trying to understand the requirements for this system in Mozambique. What do we need?
No, I don't mean to say you should
yeah.
do it right now. What I'm
I
saying
understand.
is, that is the goal. That is a very good classical design research project. And especially when you use a, as a mobile phone. It's a very, shall I say, what is that term that Rick Watson had? Frugal information.
Frugal
system.
information.
It's a good example of frugal information system. You know, people think about, oh, I need to do this, that, and the other. You can implement lots of a sophisticated system by simply using mobile phone. I'll give you one example. You know, people have these salespeople, inventory and so on and so forth. And then they devise these handheld devices and so on and so forth, you know. So salespeople go, they meet a customer, and then they use all this price and so on. If you use mobile phone, you think about it, all you need is 3 parameters. The customer only wants to know, is this available? How much is the cost? And when will it be delivered? So think about this. A group of salespeople, they go around with just a cell phone, and then they send out this to their depots, and they send back just 3 numbers. Yes, 500 kroners, or whatever, 25th of September. You have all the information to do it. So all of that, I think Siraj has done a lot of work with this, you know, agriculture based on this. So I would actually strongly encourage you to do that, and then all these so what questions will disappear. I'll tell you that. Then you have these design principles and all of these socio-technical aspects and so on. It's an interesting thing you talk about pregnancy and delivery and so on. Recently, you know, my one of my cousin's wives, for some reason, she was posting something like life is full of expectations and unexpected and so on. Everybody thought she was pregnant. And so people started sending out this, and then it turned out she was expecting a letter of resignation to be accepted. So you get into this consensual aspect, so how do you do that? So it's a good project in that sense, and you have something that you can actually.
The novelty can be the codes that because you will have to develop codes for certain messages. So if you succeed to develop
Actually, the whole
something
model
like
for
that,
that itself would be,
that's
you can
acceptable
develop
and
different types of
everything, it will be the
artifacting.
novelty maybe. Yeah.
Thank you for the encouragement. More comments or questions?
More questions? No? Okay, then we have maybe 10, 12 more minutes to lunch, and you can use it to fill in the form for him, and we have one more. So please fill for all the others except the last group, which we will